Hello, class. This is Social Service 215, Social Problems and Social Actions, Chapter 13, titled Health. What are diseases? What are disease and illness? Medical model approach. Disease as a physical event caused by a physical factor. The social control approach would be how diseases are labeled and treated. Social behavior itself may be labeled as a disease. That's correct. So therefore, I would read a little bit more about how social behavior itself can be labeled as a disease. We've been talking about social learning theory and several other PowerPoints, and how behaviors can lead to um, drastic measures which affect our physical systems, and physical factors. Characteristics of a medicalized society. So medicine sets limits of normal behavior. Health and illness viewed as outcomes of individuals' behavior or biological malfunctioning. Problems appear as products of nature. Bad patients are at fault for continuous conditions. So what this model says that bad patients are at fault for continuous conditions, meaning people are not taking the steps to influence their health care to produce, I guess what the medical model would say, better health outcomes. So they are saying they are at fault for that. Two false assumptions about health. Genetics alone explains diseases. Genetics alone explains disease, forgive me. People who are ill have made poor lifestyle choices. And focus remains at individual level, isolated from social circumstances. So what we're seeing often is that disease does not take into account the social factors that influence people. And so we're seeing that is changing with new research underway, especially within the last 10 plus years with population health being vastly pushed or studied within certain societies. Health inequalities. People from lower socioeconomic backgrounds experience higher levels of health risk. Social gradient of health is the sliding scale where socioeconomic status shapes exposure to health problems. There's a widening inequalities of wealth, also means widening inequalities of health. So this is figure 13.2, U.S. life expectancy by gender and race, 2016 to 2017. As you can see, individuals who of color here, black and brown people, have a much lower life expectancy than their white counterparts. Health inequalities by race. Of course, there's institutional racism, large scale, seen in practices of corporations. There's cultural racism. There's interpersonal racial discrimination. Then there's internalized racism as well. So please be familiar with these concepts and review. It's going to be very important for you to know these concepts. Gender differences. Women's experience of health versus men's experience of health can be greatly different, as described in the book. Women are diagnosed as suffering from more ill health conditions than men when they're diagnosed in a similar fashion. So that's something to be aware of. So are we looking at women at the same level or in detail as we are men? Are we looking at their strength besides just the physical standpoint that they present with? In regards to health, are we not looking at the psychological and the social factors that may influence too? Women also are shown to live longer than men. So the COVID-19 pandemic, the social control measures for limiting infection spread occurred. Of course, there's risk factors include age, gender, and race. And then there's expected effects of the pandemic, which you can read about definitely in the book and are great to know and very relevant to our time in history now. The U.S. healthcare system and its stakeholders. You have the government, who have things like Obamacare, the medical industrial complex, the pharmaceutical companies, alternative treatments like homeopathy, chiropractic, osteopathy, acupuncture, and herbalism. And then patients and patient groups. These are all stakeholders, all are influenced or have an influence in the U.S. healthcare system. So we look at the different theories to understand health. So functionalism, we will review Parsons, the sick role, so please become familiar with that. Doctor is a highly skilled professional, and the patient seeks out the doctor and complies with directives. This is common what we see in today's healthcare system in the United States. Trust is needed between the patient and their health provider. Conflict theory, those who suffer the most illness in modern Western societies can least afford high-cost treatment. We tend to see that. We see a ton of, or you see at times, a higher disease presence in certain communities of color, especially diabetes, hypertension, and those heart-related issues, and some cancers as well. So this might be very vital to understand. The development of costly treatment and pharmaceuticals is not the most effective way to improve health outcomes for the general population. So not just looking at prescribing medicine, but also or utilizing medicine, looking at the psychological and social factors that influence. So this is the economic functions of the United States. So you have these different functions that come together to make up the U.S. Healthcare system: provisions of investment opportunities, absorption of surplus labor, maintenance of the labor force, and accumulation of capital, all center around to create healthcare industries' economic functions. Then, using a theory to understand, we have symbolic interactionalism, which Western model of health predicts drugs should have the straightforward biochemical effects and cure conditions. And sometimes we have a placebo effect too. Specialized theories, Burundu and the physical, social, and capital culture is very important to understand. So please, thank you. Please be sure to review that. And then a social capital theory and fundamental cause theory as well. Thank you.